let's talk about Antenatal Colostrum Collection. Antenatal Colostrum Collection just means collecting colostrum, the very first milk that your body produces before your baby is born. So collecting this milk while you are pregnant. Your body starts to produce colostrum, which is your baby's first milk. It's very thick, it's very sticky. It is a powerhouse of nutrition filled with antibodies for your baby. Your body starts producing this around 16 to 18 weeks during pregnancy. You may not notice this, you may not see any changes, you might leak a couple drops here and there, you might not. All of those things are normal, but your body is getting ready to feed your baby before they're even here. You have the ability to actually harvest and collect this colostrum around the 37th week in pregnancy. The reason we want to wait to 37 weeks is we just want to ensure that everyone is safe. So provided you are a low-risk pregnancy, you can collect colostrum. The reason we want to have this conversation with our provider and ensure that we are low risk is because the stimulation, especially the nipple stimulation that happens through hand expression, because we collect colostrum with our hands and not a pump, releases oxytocin. And oxytocin is that wonderful love hormone. It does help your milk flow, but it's the same hormone that our body needs for labor contractions. The scientific evidence isn't strong that hand expression would bring on labor, but you do want to have that conversation with your primary care provider. Provided you are a low-risk pregnancy and you are about at week 37, some of the reasons you might want to collect colostrum could be if you know there might be challenges when your baby is born. So for example, parents with gestational diabetes. When babies are born after a parent has gestational diabetes, your baby could end up with low blood sugar. And having colostrum on hand that you've already previously collected, that can actually be used and given to your baby right away. If you know there might be potential challenges around separation, if you're having a scheduled C-section birth, you and your baby might have some time apart. The length of time varies significantly, and having colostrum collected in advance could help make the difference in giving your baby your first milk before they're able to latch at your body. If you're expecting multiples, it's another great time to collect colostrum. If you've had a prior breast or chest surgery of any kind and aren't sure how it might impact your milk production, that's another reason you could collect colostrum. Having the milk available for your baby in case they're unable to latch, in case they're not latching well and removing milk, in case there's a delay of when the volume of your colostrum starts to transition and increase. All of those situations are really helpful to have collected colostrum. If we know baby might have a cleft lip or palate, or feeding challenges, if baby has Down syndrome, these can actually affect their ability to feed well at the breast. And having colostrum just helps us supplement them and ensure that they are getting enough milk without needing to bring in other interventions. So Antenatal Colostrum Collection can be used by so many people, and it is really valuable. If everything goes smoothly and you don't end up needing the extra colostrum that you've collected, that's okay. You can save it for times when your baby is sick because there's so many antibodies there to support their immature immune system. So what do you actually need to collect colostrum? All you need is clean hands, ideally with short nails, and you need some oral capped syringes. So this is just a syringe that has no needle on the end, and they're very easily accessible. You can purchase these on Amazon, you can purchase them from birth supply stores, some pharmacies carry them. You do not need a large one. This is only 1 ml because colostrum is produced in very small quantities, and the amount that you're going to collect is also going to be in small amounts. So 1 ml syringe is perfect. Then you need a clean spoon or a small plastic cup, a medicine cup, something to collect the milk into. You also have the option, especially the first couple of times that you do hand expression, to actually use a syringe and gather it directly from the nipple. You may find that that's a little easier. especially if the milk isn't accumulating enough to drip onto a spoon. So we do want to start by gently massaging the breast. So you can have a shower beforehand to make sure you're nice and relaxed. We got, the warm temperature to make sure that the milk is flowing. And then we want to do some gentle massages. You can start by doing circles right around the areola. We are being very gentle on our breast tissue when we're doing this. Breast tissue is nothing like the muscle tissue in your body. We do not want to be doing really aggressive massage. We can actually damage the structures of the breast. So some really gentle circles. You can use your knuckles, again, very, very, very gentle. You can do what's called the shake, where we're just sort of jiggling and moving around the breast tissue. We're doing all of this to help get the milk flowing. From here, you want to begin using hand expression, which is just a 3-step process. It's very, very easy to replicate. You want to place your fingers, so your thumb and your index finger, about 1 inch back from the nipple. We're using the nipple to measure because the areolar size varies significantly from person to person. So we want to be about 1 inch away from the nipple. And from here, we just want to push back towards our ribs, bring our fingers together, so compress, and then just relax and release it. So we are compressing, we're going to press back, compress, and release. And you're just going to keep doing that over and over. You can change position of your hand so we can make sure we work our way all the way around the areola, get all of those milk ducts. And that is what you're going to do until you see colostrum. Do not be discouraged if you do not see any drops of milk after several attempts at doing this. That's normal. Colostrum is produced in very small quantities. It's very thick. It's going to take a little while, especially the very first time that you do it, for your body to start releasing this milk and for you to start to see more. The entire process could take anywhere around 20 to 30 minutes. The actual hand expression and collection part, you only need to do for about 10 or 15 minutes. And if you're collecting milk prior to baby's arrival, we want to do this about once or twice a day for 10 or 15 minutes. And what you would do is just fill the syringe as you collect the milk. So once you do 1 round and you have, it might even be 0.05 ml, which is fantastic, in the syringe, you then want to put the syringe in the fridge. It's breast milk, it needs to be refrigerated. When you go to do your second round later in the day of hand expression to collect colostrum, use the same syringe, collect the milk into it, put it back in the fridge. You can leave it, you can use the same syringe for a few days, and from there you want to move it into the freezer. We want to make sure that it is stored in the freezer, especially because it's going to be weeks, hopefully, before baby arrives. So we want to follow safe breast milk storage guidelines and store it in the freezer. What I would also encourage you to do is have those syringes in a Ziploc bag that is labeled with your name. And if you can actually label each syringe, even a little piece of masking tape with your name and the collection date, is ideal, because if you're having a hospital delivery and you have the ability to bring your colostrum to the hospital with you, we want to make sure your name is on it, and the date is just for using the oldest milk first. After your baby arrives, knowing the technique of hand expression can be, or is incredibly valuable to have throughout the duration of your breastfeeding journey. You can use hand expression in between your baby's feedings to express a little bit more milk. It actually will help in those early days transition your milk faster. It will help, in addition to feeding your baby on demand, establish a strong milk production. It's helpful if you're experiencing inflammation in the breast. So when we have a blocked duct, there's inflammation happening. Knowing how to do hand expression in addition to other massage techniques is really helpful. You can use hand expression after a pumping session to help ensure that you are making as much milk as possible. And you can use hand expression all the way through to the end of your journey when you're weaning. to ensure that you're remaining comfortable as you start to space out your feedings. So knowing how to do hand expression is essential for when we are collecting colostrum before a baby is born, but that is a skill that is actually going to help you throughout the duration of your breastfeeding journey.